I'm joined now on the show by Dr. Yaron Wu, who is a licensed acupuncturist and joins us here every week. Dr. Wu specializes in the treatment of type 2 diabetes, infertility, depression, hair loss, and chronic pain. You know where to go for more info. Visit the website upliftingyourhealth.com. You can talk to Dr. Wu at 408-480-2860. Use that number to book an appointment. Dr. Wu, good morning to you. And I know you've brought somebody with you.
Good morning. Actually, I have my patient Bill with me this time.
Okay, Bill is your patient, so he's been to your clinic. I'm guessing is getting treated for diabetes. What is Bill going to talk to us about today?
Actually, he came from last time the seminar for diabetic and he started treatment. So I'm hoping to ask him to share his story a little bit.
So the seminar in June that we were talking about?
Yes.
Oh, okay.
Yep.
All right. So Bill is a new patient.
Yeah.
So Bill, I'm going to welcome you to the show. Good morning to you and tell us about your experience there.
Good morning, Sarah. Actually, I'm the 62-year-old and I'm a diabetic patient. My diabetic average is 160 to 170, but suddenly my diabetes level up to the 250 to 300. And this time being, I'm always listen to your radio, Bollywood radio, and I hear about Dr. Wu's seminar on June 14, I attend and I'm very impressed. So after that, I joined for diabetes treatment. So I start my diabetic treatment on about June 15. And within 2 days, my diabetes dropped from 250 to 191 in 2 treatments. Wow. But I strictly followed Dr. Wu diet program, what he gave me instructions, strictly with his diabetes treatment and his diabetes diet program. My diabetes level, every treatment, my diabetes dropped from 191 to 183 to 179. Every day, my diabetes dropped 174 to 169 to 121.
Wow.
Today, my diabetes level is 101 to 105.
Wow.
So result is, very well as a Dr. Wu treatment.
Yes.
Plus, I strictly follow his diet program. What he give me the dietary program,
Yeah.
I strictly follow his program and his treatment very well work.
Thank you very
Thank you.
much for sharing that, Bill, with us, right?
Actually, Bill is the best patient. He follow everything and he came here every day. And we just see the blood sugar level drop every day. That's amazing.
But that's amazing.
yeah,
I mean,
not only from me, also from his effort as well. That's one thing I want to thank Bill.
yes, but I think you're so right because it's always a doctor-patient team effort, right?
Yes.
They both have to work at
Yes.
their ends. Just for anyone who tuned in late, that was Bill who heard us talk about Dr. Wu's seminar, the one in June, which was about diabetes. And he registered with Dr. Wu and you heard him talk about how dramatically, because he's been following all instructions, his blood sugar level has been coming down. So congratulations, Bill. That's fantastic. So, Bill, you've lost some weight as well, I hear.
Yes. Today, my diabetes level is 101. Plus, my weight also lose 10 pounds. Before, my weight is 165. My weight today is 155.
Wow.
So I strictly follow his fasting, diet program. So if you follow his fasting program and his treatment is really helps really, really well.
Yes, as we can see, that is fantastic. And I do want to remind everybody, so Bill heard about the last seminar in June and is a new patient with Dr. Wu, but already in the space of, a few weeks, he's seen a dramatic result and a dramatic change. So how does that, you've lost some weight too, you've lost, blood sugar level has come down, you've lost some weight. And Dr. Wu is telling me, you told him I feel a lot lighter.
From the fast and diet, yes.
Yeah, from diet and fast, I feel very good. I feel in my body, energy and feel very well, I'm not feel tired.
That is, Dr. Wu, you wanted to add something, I think.
Actually, basically, I didn't give any herbs to Bill.
No herbs, okay.
Yeah, all the treatments physically. The monoxide heating therapy didn't touch his body at all. And acupuncture, put it in needle, would take it out. Mm-hmm. And I told Bill to, skip some meal according to intermittent fasting.
Okay.
And he followed every day, whatever I said, and he came in every day.
Okay.
So every day he came in, his blood sugar is dropping. That's so amazing.
That
So
is
that's
amazing.
one thing I want to thank Bill. He make my job much easier. He
Yes.
did his part, so my job part is much easier. And we're both very happy for his outcome.
That's
And the most weight he lost is around his belly.
Oh,
Again, anybody has a big belly,
Yeah.
you're diabetic, you have to lose weight around the belly.
and that is always the hardest to lose, right?
Yes, that's the point.
Yeah, that is the point. So
Yeah.
hardest to lose. And you're right. So this is a dream patient for a doctor.
That's right.
Someone who will listen to every instruction and follow it to the T. So great team here now, Bill and Dr. Wu.
Actually, I want to ask Bill talk about his fasting because sounds like I have a patient called me say, I did 3 years intermittent fasting, didn't work.
Yeah.
And why Bill's is working. And also there's patient listen to fasting like horrible thing. You don't
Yeah.
want me to eat?
Yeah.
I said, no, I want you to have a real food,
Yeah.
real life.
Yeah.
But I don't want you overeating and I'm fighting your diet instead of cleaning up whatever trash in your body. Anybody get diabetic is because you're overeating
Yeah.
carbohydrate or sugar
Yeah.
is stored in your body so much.
Yeah.
So I'm hoping Bill can share a little bit how he feels and what he did.
And I think that what you just said made a lot of sense because if you're overeating, then what you as a doctor are doing is fighting that trash and not actually fighting, the trash that you've put in your body, and you're not actually fighting the ailment.
That's the point.
Yes, and that's a good one to actually for everyone to keep in mind. So, Bill, tell us about how you did it. The fasting that he recommended. What was that, and how did you stick to it?
Yeah, the doctor strictly warning me, okay, if you do my treatment, you have to strictly follow my fasting diet program. So, before my, I don't follow my fasting, So, in the morning I take junk breakfast and lunch, afternoon, and evening I take my full dinner. But after the joining with Dr. Wu and his instruction, in the morning when I take my breakfast, I take omelette and a cup of tea.
Yeah.
And lunchtime, I take a light lunch. And one day I skipped my dinner, but the next day, when I take my dinner at 5-6 o'clock, I take light dinner, not full. Usually I take my full dinner, but I cut my dinner half. So it helped me really well.
Okay, so it's portion control also. It's fasting and portion control. When you eat, don't overeat.
First, no sugar.
I don't eat overeat. When I take my lunch,
Yeah.
also I don't take my lunch over, So that
Over a
helps me
certain-
really well.
All right. So, Dr. Wu, yes, before
Yeah.
we run out of time.
Basically, no sugar.
Yeah.
And replace the carbohydrate with like omelette, protein, or fat.
Yeah.
And for Bill, he did very well. Skip one dinner every other day.
Okay.
Basically, out of 1 week, 21 meals, maybe skip 3 to 4 dinners. That's all.
That is what you call intermittent fasting.
Yes.
Okay.
Yeah.
And
So it's not hard.
Usually we eat the rice. Every dinner we have rice.
Right.
But I totally cut my rice. I
yes,
totally
the sugar
cut the rice.
and yes, we are out of time. But thank you so much for sharing that because that there are so many people who want to do it and they cannot. But this is, I think, important for everyone to know that if you stick to that plan, then things can be done.
Yeah.
And anything else that cannot be fought by just control of diet, Dr. Wu will take care of that.
Actually, I tell patients if you skip 10% of your meals,
Yeah.
you can eat maybe 20, 30 years, whatever you want to eat.
Yeah.
Or you can eat whatever you want, and 2-3 years you cannot eat at all. So your choice.
Your choice. All right, we'll have to leave it there. Thank you very much to Bill Thakur for sharing his experience with us, and also to you, Dr. Wu.
Thank you.
Thank you.